Let's now discuss enuresis and incontinence with the patterns heart fire and damp feet in the bladder. First, let's talk about heart fire. Its clinical manifestations, there will be nocturnal enuresis lasting into later years, nervous child, palpitations, thirst, insomnia, and crying at night. The tongue will be red with a redder tip and with red points, thick yellow coating. The pulse will be overflowing on left front position. This pattern may be combined with a kidney deficiency. Such a combination is often seen in children's nocturnal enuresis. The treatment principle, drain heart fire and calm the mind. For the acupuncture points, we can use heart 8, REN 14, spin 6, and kidney 3. And use the even method. Heart 8 and REN 14 drain heart fires, spin 6 and kidney 3 tonify the kidneys. Now let's go to damp feet in the bladder. Its clinical manifestations, there will be nocturnal enuresis or incontinence, difficult urination, burning on urination. The tongue will have a sticky yellow coating and the pulse is slippery. Treatment principle, clear heat and resolve dampness, promote the bladder's chi transformation. The points to use are spin 9, spin 6, REN 9, stomach 28, bladder 22, REN 3, bladder 28, and bladder 32. For the needling technique, we use the even method. Spleen 9, spleen 6, REN 9, and stomach 28 and bladder 22 resolve dampness. REN 3, bladder 28, and bladder 32 promote the bladder's chi transformation and open the urinary passages. For the prognosis, acupuncture and herbs can give good results in treatment of enuresis and incontinence. As for enuresis in children, if the child is under 10, a brief course of acupuncture may sometimes suffice to produce a cure. If the child is over 10, enuresis is more difficult to treat. Of the two types of enuresis, the deficiency type is easier to treat than the excess one from liver fire. As for incontinence, it usually responds to treatment with acupuncture and herbs in a few months, unless it is due to a neurological disease such as multiple sclerosis, in which case it may not respond to treatment at all, or may respond only very slowly. For blood in the urine, it is characterized by the presence of frank or occult blood in the urine, usually without pain. If it is accompanied by pain and difficulty in urination, it falls under the category of urinary syndrome. If there are large amounts of blood in the urine will be smoky colored, bright red or reddish brown, and this condition is termed gross hematuria. When blood is not visible to the patient and is discovered accidentally during routine tests, this condition is called microhematuria. Hematuria may be caused by various different diseases such as nephritis, endocarditis, polyarteritis, systemic lupus erythematosus, if it affects the kidneys, TB of the kidneys, polycystic disease, hemorrhagic disease, tumor of the kidney, infection of the lower urinary tract, and carcinoma of the prostate or bladder. When blood is present in the urine, a cause should always be sought and found in Western medicine. It is therefore essential to get a proper Western diagnosis from a urologist. It is convenient to classify hematuria into pre-renal, renal, and post-renal, depending on whether the cause resides in organs above the kidney, in the kidney itself, or in organs below the kidney, that is bladder and or prostate. Timing of blood in the urine stream provides another clinical, though non-specific classification to localize the source of bleeding. When blood appears only at the beginning of micturition, the source of bleeding is below the bladder. When blood is uniformly mixed with urine, it may come from anywhere above the urethra. Here is an illustration of the causes of blood in the urine in Western medicine. If it's pre-renal or above the kidneys, it may be due to endocarditis or due to drugs like warfarin. If it's renal, it may be due to glomerulonephritis, pyelonephritis, carcinoma of the kidneys. If it's post-renal, it could be due to cystitis, carcinoma of the bladder, or prostatitis. A red flag in Western medicine is the progression of, in case of progressive incontinence of recent onset. Neurological disorders must be excluded, such as normal pressure, hydrocephalus, usually associated with dementia and gait disturbance, multiple sclerosis, Parkinson's disease, and amyotrophic lateral sclerosis. Thank you for your attention.